Good evening, everyone. My name is RP Menzel. I'm conducting my scavenger hunt and SWOT analysis on Voices for Healthy Kids and Action for Healthy Kids. I'll be covering an overview of both of the organizations. We're going to talk about campaign objectives, the target audience for both campaigns, their key messages, channels of communications. I'm going to give a media analysis comparing the two. We're going to talk about the outcomes, and then I will give my SWOT analysis. Voices for Healthy Kids is organized by the American Heart Association, a nonprofit organization dedicated to funding cardiovascular medical research and promoting heart health. Voices for Kids works around the country to improve or create equitable policies that will make the places kids live, learn, and play healthier. They support state and local policies that increase access to healthy food and beverages, decrease access to unhealthy food and beverages, make it easier to eat healthy, and drive industry innovation to improve the healthfulness of food and drinks. This campaign started in 2013 and celebrating their 10th anniversary in 2023. Action for Healthy Kids is a national nonprofit that brings together dedicated volunteers and partners to make schools healthier places where kids thrive. Their mission is to foster learning environments that support optimal child health and well-being through evidence-based programs, resources, and partnerships. They help schools and districts advance policies and practices that promote student health and well-being. The campaign started in 2002 and continues to this day. Action for Healthy Kids spearheaded the movement in the early 2000s that changed the way schools approached health and wellness, seeking to address the growing concerns over childhood obesity and the lack of access to nutritious foods and physical activity in schools. The primary objective for both campaigns is to address the childhood health crisis, including critical issues like obesity and mental health, both aiming to improve the overall health of students through systemic change. Both organizations work to advance wellness policies and practices in school communities through evidence-based programs, resources, and partnerships, and both conduct research as well. Voices for Healthy Kids partners with the Robert Wood Johnson Foundation, awarding grants to advocacy organizations already active in childhood obesity prevention to encourage evidence-based regulatory and legislative activity with the greatest potential for impact. Action for Healthy Kids offers a comprehensive set of services designed to meet the unique needs of schools and districts at different levels of readiness and capacity, including district impact partnerships, training and professional development, technical assistance, policy and program support, and grant funding. The primary target audience for these programs are school districts and childhood development organizations. They create content and resources aimed at assisting and training employees, advocate for and reshape childhood nutrition. A secondary audience for their campaigns are donors and other organizations to partner with. Voices states that they focus on working with advocates to meet decision makers across the political spectrum where they are, communicating in a manner that resonates with their values. Voices for Healthy Kids states that they focus on value-based messaging, learning to better understand those that they seek to influence and find common ground. Voices for Healthy Kids offers tools, training, and guides that help customize messaging that appeals to those with the power to make change. Action for Healthy Kids states that their mission is to foster learning environments that support optimal child health and well-being, because they believe that healthy children make a better world. Both organizations have similar social media strategies, where the only difference is that in Instagram, Action for Healthy Kids has over 3,000 followers, whereas Voices for Healthy Kids aren't even on the platform. Otherwise, both organizations have YouTube channels and disseminate their content primarily through that platform. Their content posted is mostly training and reference videos, but they do feature their advertisements on these channels. They both have Facebook accounts as well, with Action for Healthy Kids having over 32,000 followers and Voices for Healthy Kids having around 20,000 followers. Both organizations have produced TV spots, with Action for Healthy Kids making We Need You on October 31st of 2023, and also promoting health equity for all kids on June 8th, 2023, and Voices for Healthy Kids creating junk food marketing in schools on August 2nd of 2018. Both organizations have extensive coverage over the last decade or so through local news articles, disseminating newsletters, and a whole team for outreach. Most of the information put out by these organizations can be found on their blog, with heart.org blog for Voices for Healthy Kids and Action for Healthy Kids blog on their website. These campaigns have been going on for some time, so it's hard to say for certain what impact that these these communication strategies have had on their outcomes. As far as Voices for Healthy Kids, some of their organizational outcomes is $7.2 billion secured in appropriations to support mission-related programs and services that address the root causes of childhood obesity and health inequalities. 500 plus organizations participating in the Voices for Healthy Kids Advisory Committee, work groups, and other collaborations. Over 72,000 online grassroots advocates, almost 400 policy successes reaching more than 298 million people in the United States, as well as 26 national message research projects. Action for Healthy Kids, on the other hand, has awarded nearly 30 million in subgrants to 264 school districts across 44 states. 173 individual members representing 25 states, 66 school districts, over 9,000 schools, and 5.4 million students impacted, in which 67% of surveyed students improved their attitudes towards eating fruits and vegetables. As far as paid media goes, the most significant productions are their TV spots. Both organizations have a few earned media spots, news outlets primarily, including PR Newswire, but is also featured with frequency by UNICEF and the USDA. Both also have fairly robust coverage in the local news outlets of various communities that they've impacted in the past. For shared media, these campaigns work primarily on partnerships and then receive most of the media through these partnerships. Often they're partnered with the same organizations as both partnered with the NFL to promote healthy choices for adolescents, but haven't partnered with each other directly. Another significant portion of media put out by these organizations are their owned channels, including their websites and blogs where they host info and content specifically aimed towards training. They also feature news, articles, and other resources directly from their homepage. As far as my thoughts on their social media strategies, Action for Healthy Kids has several social media platforms that they distribute content through, but not a lot of engagement on any of them, which I found to be a point of weakness. Their YouTube content of years ago only has a few hundred views at most. Last month's posting are sitting at under 50 views, and while the channel has over 400 videos uploaded, they only have 800 subscribers. This shows a level of inactivity that could be hindering their performance. It's a similar case for Voices for Healthy Kids, where the purpose of the channel is primarily training and resources that drives no engagement or views. The biggest strength of both campaigns are their partnerships, with some of the most notable for Action for Healthy Kids being Gen Youth, the USDA, and the NFL, and for Voices for Healthy Kids being the Robert Wood Johnson Foundation and funding from their parent organization, the American Heart Association. Some weaknesses that could be hindering their performance is their social media presence, outdated and irrelevant media and training communications through their online channels, and few earned national media coverage spots where nonprofits could really shine. As far as opportunities go, reaching out on social media and getting parents, communities, and local officials involved is a strategy I think both organizations could improve on. Both organizations have a fair amount of paid, shared, and owned media, but could benefit from more earned media, sponsoring more events and getting the word out there that these organizations are the front line to your kids' health. Small donors are an avenue to make up for any funds or grants that could be withheld or diminished by the federal government. Social media is a great way to spread the message further, localize the impacts, and get more people in districts aware and excited to contribute. The major threats facing both campaigns are funding. Voices for Healthy Kids has the advantage being part of a larger and more established organization, but these organizations see a lot of their funding investments come from national social spending programs, overall of which see an increasing amount of pressure. Although Action for Healthy Kids has a decade on Voices for Healthy Kids, the latter is funded by one of the largest health organizations in the nation. I believe by sheer size and figures that Voices has a bit more reach and a bit more funding, but that doesn't mean that Action pales in comparison. I think both, although extremely similar in form and function, have something to offer kids and programs everywhere. I think their most effective strategy to date is their partnerships they create with other organizations. Another strategy I believe to be effective in this campaign are the TV spots from both organizations. Overall, I found their reach to be lacking in the social media space. Their online channels, save their website, don't promote their brand very effectively, and with a more comprehensive media approach, they could expand their umbrella to more communities. I'm RP Menzel, thank you for listening.